Now, if we can turn to the vaccine administration, what are the preparations done by the state government to administer COVID-19 vaccine, and what are the steps taken by the government to convince the people to take the vaccination? Now, this question is asked by Gracia Pasa.
Okay, regarding the preparatory phase, the state, we have already collected data of the healthcare workers, and then registration of these workers, of the data of these workers are going on. And also regarding the human resources, the people will be involved in the activities of organization, training and capacity building of those people are going on in the state district level. And also about the cold chain system. When I say cold chain system, means the storage of the vaccines, the place, the equipment, how to store the vaccines, and about the syringes and the vaccine itself. So regarding this cold chain system, about storage space, we have already identified at the state regarding the cold storage and as well as the dry storage. And also at the district level, this have been on the process. And then we also involve the other department also to be part of the activities to help us, because health department is the only department which will concern for immunization and vaccination of COVID-19. So the other department also are in place. And also for the identification of the session site also, and the allocation of the session sites to the beneficiaries. And also we are look into the EFI events, like we said, the EFI, so the surveillance system right from the state level, district level are in place. And we have also trained all the health workers, the vaccinators, the MOs, how to deal with the AFI. And the last but not the least, supervision and monitoring system also is on the process. And also the last reporting also we have put in place how to report all these activities.
Yeah, just to add on, because this is the preparation being made at the state level that Dr. Manners had just narrated. But at the district level also, to add on to what has been done, we have also identified the potential vaccinators who are going to be part of this activity. And then we also have the district task force committees that have been set up, whereby the different key departments have been involved together so that we can get the support from these departments in terms of logistics. And the formation of the committees also have been cascaded down right up to the block level, where we have the block task force committee also doing these preparing for this exercise at the block level.
One question from one Judy Barre wants to know whether the vaccine will be provided free of cost for all citizens. Now, is there an option for the citizens to decline vaccine administration?
Yes, the vaccine will be provided free of cost for all citizens, and also the citizens can decline vaccine administration.
Now, if I have already recovered from COVID-19, do I still need to get vaccinated?
Yes, you still need to get vaccinated. Like I said previously, that because the immunity from the infection does not last long, so we need to be vaccinated to get to make the immune response stronger, so that will be prevented from disease.
Now, why would the vaccine be needed if we take enough care and precaution towards preventing the spread of COVID-19 virus?
The vaccine is there to protect you from getting the COVID-19 and from ending up being hospitalized. However, you may still be contagious and you may spread the virus. Therefore, you need the vaccine to prevent this severe transmission of the virus, which if we are not vaccinated, like Dr. Im Yong has told us, we need at least 2/3 of the population to attain what we have called a herd immunity, so that we are then protecting that vulnerable group that we have, the young, the very old, and immunocompromised patients. These people cannot take the vaccine. And when all of us take the vaccine, then we are aiming to get that herd immunity. Thereby we can go back to our pre-COVID days, which should be our goal.
Now, are masks and physical distancing necessary after receiving the prescribed doses of a COVID-19 vaccine?
Very much, because it takes at least 2 weeks after the second dose for the body to evoke an immune response, or to say that we are protected from this from the COVID-19. However, again, as I said previously, we may still be contagious, we may still be harboring the virus, we may still be spreading it. Therefore, all the health advisories of social distancing, masking, etc., must be kept up.
And
until such time that we receive this herd immunity.
How long does it take to develop immunity following vaccination? And how long will the vaccine immunity last?
I think we had answered this previously, but again, I'll just repeat it. Immunity from the vaccination will develop 2 weeks after the second dose, and it is said that it will last 6 months or be something like the response from the flu vaccine.
Will it be safe for people with hypertension, diabetes, heart diseases, kidney disease to administer the vaccine or to accept vaccination? If yes, what are the precautions that one can take?
Oh yes, these are the people which are considered as high-risk candidates for vaccination. They are the target groups for vaccination. However, before they get vaccinated, they need to consult their attending physician to seek their advice in case of any anaphylaxis or shock, as we may call it in layman's term, because each individual differs from another individual. Okay, so they need to get their attending doctor's advice before they get vaccinated.
Now, on COVID vaccine and safety, we are told that approximately 25,000 health workers of Meghalaya will be administered the COVID-19 vaccine in the first phase. Are they insured for any unseen eventualities?
All health workers have already been insured since the start of this COVID pandemic, and there is a particular scheme of the central government which has about 50 lakhs, I think, per health worker. That's an insurance scheme already being provided to each and every health worker. So as it is with COVID vaccination, I'm sure that this same scheme will be extended also for coverage of the health workers with vaccination.
We have a question from one Kavita Nahar. Kavita wants to know if there are any centers in Meghalaya for reporting side effects of the vaccine. And after vaccine administrations, are side effects like vomiting, headaches, or mild symptoms important enough to report?
Regarding this question is about AEFI, that is adverse event following immunization. These are the usual side effects, like Dr. Eva has already mentioned, is because of the component of the vaccine. So regarding these, all the medical officers at the facilities, at the CACs and PACs are trained how to tackle with these AFI. Even the vaccinator also have already been trained how to tackle with immediate AFI, for example, allergy, anaphylaxis, etc. All the beneficiaries after being vaccinated, which they should wait for 30 minutes in the vaccination in the waiting room, so that we'll observe if there's any side effects or any reaction. So regarding this, there should be a notification from an AM to the medical officer, and accordingly we'll treat according to the procedure, according to the process.
And to add to that, the question was that are they supposed to report? Yes, they are supposed to report. Our vaccinators, our ANMs should always give this message to the people who are vaccinated, that with any kind of change in, maybe like vomiting or headache they have or they may experience, they need to inform the health center or those health workers who had vaccinated them. That is the usual practice, even with other programs which involve immunization.
Okay, one last question for our panelists in this program is, once a person has been vaccinated against the coronavirus, is that person exempted from the lockdown restrictions?
Again, we're parroting what we have already spoken earlier. You are vaccinated, you are protected, you'll probably be protected from ending up in hospitals, etc. But you still may be contagious, you still may harbor the virus, and you may still spread it. Therefore, you are still not exempted from health advisories that are given, not lockdown as such, but I would say health advisories given from time to time by the department. Like social distancing, wearing of masks, these will help to slow down the spread or the transmission of the virus. Please remember, wearing your mask and social distancing will slow down the spread of the transmission of the virus. This will give us valuable time to recoup our resources, especially at public health levels. Thank you.
I think in this case, if they say lockdown restrictions, it may also refer to the fact that people who have been vaccinated, if suppose they do reside in an area which has been identified to be under containment, then they have to follow the protocols of containment, even after vaccination. Like we say, wearing a mask, social distancing are still to be, followed and strictly adhered to. So same thing even with the lockdown, meaning if you belong to a containment zone, whereby you are not allowed to come in or come out or go in, then we'll still have to follow even after vaccination.
Perhaps any of you would like to add something to what you have just answered?
I would like to make an appeal to the public that we would really, appreciate if they all cooperate with us in ensuring that they follow the health advisories which we are giving, which will bring about not only protecting themselves from contracting the infection, but also protecting the family, their immediate family members, protecting their neighbors, their co-workers, and in the process, add to the protection of the community at large.
As we have understood that vaccination is very important, and because by means of vaccination only we can protect ourselves and also prevent the spread of infection to our near and dear ones. So as of now, since we haven't received this vaccination yet, so I request all of us to please maintain social distancing, hand hygiene, and also other measures. And I want to ensure you that when we get any information, we want to give this information, clear information, transparent information to the public to understand this vaccine properly, so that there will be no hesitancy, so that there will be eagerness how to take this vaccine, because it's very important. So with these words, I think everyone will have understood about this vaccine.
Well, that's it for today, but don't worry, Meghalaya Answers will be back on our next episode with our experts to answer more questions related to COVID-19. Stay safe.